So today is the first day that we're working under our new COVID-19 protocols. We're taking all precautions to make sure that we can keep our firefighters safe, also our patients. You know, this is an unprecedented time, not only for our country, but the world. And so we need to make sure that our first responders are healthy, safe, so they continue to make runs. You know, one of the things, it's not only for COVID patients, but, you know, obviously other emergencies aren't going to stop. So we need to make sure that we're prepared to continue going out the doors, whether there's a fire, a stroke, or whatever that may be called.
We got construction up there.
Some of the precautions we're taking is inside of our ambulance are getting completely disinfected every morning and then after each run. So equipment is going to get completely disinfected. We're making sure that we cover almost everything that would be exposed in the back of the ambulance before run. We're even compartmentalizing the ambulance. So we normally have an opening to where the drivers are. We're making sure that that is taped off and sealed. One of the other things, you know, is obviously if we do run on a patient that meets a criteria, and that's something that dispatch is doing for us now, they're going to ask more questions to find out if certain patients meet criteria. If they do meet that criteria, then we're not going to send in the normal 6 firefighters that we would on that run. We're going to drop that back to 2 firefighters, and we're going to make sure that they're wearing the correct PPE, which is protective gear. So we're going to have gowns, goggles, glove, and an N95 mask on those individuals so they can go in and hopefully keep that exposure to the most minimum we can.
Additional measures we've taken is when our shift starts at 7 a.m., firefighters are going to be asked a series of questions to check on their health. We're also going to take their temperature to make sure no one has any temperatures. And we'll again do that at 7 p.m. just to make sure nothing's changed throughout the day. During the day, we're also going to be cleaning the station much more thoroughly. All of our doorknobs, light switches, computers, phones, door keypads, remote controls are all going to be disinfected at least daily, if not more. Obviously following the CDC rules of washing your hands more often. The more often you can wash your hands, the better it will be.
So we're trying here during these unprecedented times to make sure that we're doing our best. And some of those things that we've implemented are, we're stopping our training. Normally we'd be doing extra training. We're not doing that right now. We're trying to implement social distancing ourselves. We're keeping our distance in the stations as much as we possibly can, along with obviously disinfecting and washing our hands. And then we're also just asking our citizens to remember, you know, America rises together during these times, and I think that we're asking here in our city that people be good neighbors. You know, make sure that if you have the elderly or the sick in your neighborhood, you call them, see if they have anything they need. If you can't get a hold of them, make sure you wash your hands, go over, knock on the door, keep your distance, safe distance for them, but make sure that you're asking them if there's anything they need that you can go out and get for them.